Hello. Do you have an L4, L5 disc bulge or disc herniation that's not getting any better despite the fact you've tried exercises and conservative care? Well, in this video, I'm going to show you my proven way that we've helped people get out of pain from L4, L5 disc bulges. And this method I've been using has worked in over 95% of the cases over the last 30 years. So I'm Dr. Gregory Kramer, certified corrective care chiropractor from Chiropractic Biophysics. I've been helping people with disc problems, like I said, for over 30 years. Our job is to get you out of pain, stabilize your spine so you can live stronger longer. So this video is for those of you that are not getting better. So maybe you've tried chiropractic, maybe you had physical therapy, you've done the exercises, you've had shots, you've had surgery, and you are still suffering. It's not your fault, all right? There's usually an overlooked area, all right? And in my experience, there are 3 areas that we look at that are commonly overlooked, all right? Let me show you on this little model. This is a picture of a spine. This is a disc.
Hold it up.
So this disc absorbs shock. Well, what we want to do is balance the loads on the disc. And there's 3 things that will affect the loading of this disc. Number 1, are you out of alignment from the front? In other words, is your spine shifted? Do you have a curvature? Okay? Out of alignment from the front will create abnormal loading. And abnormal loading over time breaks the disc down, eventually leading to a L4, L5 bulge or L4, L5 disc herniation. The second thing is, do the individual vertebrae move? So when we bend, we move, when we lift, we want the forces distributed evenly over every one of the lumbar vertebrae. So if you have 5 lumbar vertebrae, each vertebrae and disc should handle a little bit of force. Now we've talked about this in other videos. So when you bend, every vertebrae should move just a little bit, okay? These red vertebrae are the bones that are stuck, or what we call subluxated. And you can take an X-ray and see which vertebrae move and which ones don't. So the second reason why the disc can have abnormal loading is that the vertebrae are stuck and they're not moving properly. So again, if the force should be distributed over 5 and you've got 3 bones that are stuck, that means the force is going to be excessive on 2, and that could eventually lead to a bulge or herniation. So we got bad alignment from the front, we got bad movement of the individual vertebrae, which means they're not moving. So the red bones are stuck. All right? The third is you could have a misalignment from the side. Your rib cage could be shifted forward. Your rib cage could be shifted back. You could have too much or too little curve. Each of these can play a role of abnormal loading. And you know what? It's not your fault. I mean, these are common factors that are often missed. Despite the fact you've had traditional care, despite the fact you've tried exercise, you've tried what I call general chiropractic, you've tried physical therapy, you've had shots, you've had epidurals, you've had perhaps even surgery, a laminectomy, or even a fusion. Well, there's hope. And the first step with everyone is an accurate diagnosis. So what I'm going to do is I'm going to take you through a case, okay? A patient of ours, and this guy is athletic, he's a bodybuilder, he's fit, and you know what? He was in agony. So when we look at this slide right here, what we're looking at is him from the front. And you will notice when we look at the blue line is where you should be. Now, let me start. Let me go ahead and let me go get the X-ray, so hold on one second. And I'm scrolling through his X-rays, and this is where he started. As you can see, not a straight spine. Blue line is where you should be. Yellow is where he was. Not good. A lot of pain. Disc herniation, L4, L5, right in here. Now, what does his posture look like? He was crooked. His posture, his rib cage, this is his rib cage. This is his hips. His rib cage is to the right of his hips. And it matched his X-ray, okay? Now, what did we do? We did adjustments, we did exercise. we did traction. Now, what does traction look like? Well, in this case, this is what we see. So his rib cage was to the right of his pelvis. And as a result, it was a severe displacement, creating tremendous pressure on the disc. Just walking under the force of gravity, eventually that disc is going to break down. Okay, sometimes a small little activity can break even a very strong man down, because it's like the straw that broke the camel's back. That's not the first step of the injury. So sledding, bouncing on your butt, lifting weights, all can contribute to it. However, if your spine is aligned, you can adapt to the forces. So this is a type of corrective spinal traction, and it's based on what your X-rays show. And what we were doing is we were able to shift his rib cage from the right to the left relative to his pelvis. Now, bear in mind, when he first came in, he could not tolerate this. So this is not what we did with him day one. Day one, we did pain relieving procedures, but once he got some of the inflammation reduced, he's got his mobility better, once the muscle spasms starting to go down, we were able to do more and more. So we started out with you'll notice there's some blocks here. We started out with a very low block. So everything we did was pain-free. But this is the end stage of what we used to correct his alignment, to take pressure off the disc so he can get out of pain and live stronger longer. Now, what are the results? Besides pain relief, he was stronger, he could play with his kids, his digestion's better. Hold on, let me show you what his X-rays looked like. This is where he started, and as you can see, blue line is where he should be, the yellow where he was. In about 30 days, we took another X-ray. Big change. His yellow line is getting closer to the blue. He's feeling better. He has less pain. He's moving better, sleeping better, working out better. But obviously, he's not fixed. And this is where he is in 3 months. Huge change. Now, one of the things that we also did is we added a sole lift in his shoe. So when we look at this X-ray here, you will notice that there's a jagged yellow line. That should be horizontal. However, the foundation of his pelvis and sacrum was low, so he had a short leg, which we can see here. This bone right here is the top of your femur, and these two lines should be superimposed. There should be no gap between. So we see that he has a short leg, and that is kind of predictable with this type of misalignment pattern. So at about the 1 month or probably 6 week mark, we added a lift in his shoe, and as a result that helped balance this line. Notice right here that there's no difference. It looks like it's one line, that we balance the foundation of the spine, and just like if you have balanced tires, the load on the tread will be better. So this is where he was before. As you can see, this area, that there's a big difference between the jagged line and the straight yellow line. And we put a lift in the shoe that helped balance the spine. So in addition to adjustments, exercise, and traction, we also did put a shoe lift. And this is his end result. Again, great correction. That was within 3 months. Now we created an environment so his spine is stronger, and the chance of having another problem has been greatly reduced. Now, here's another side. Look, this is the side view of his neck. As you notice, his head is on backwards. All right? So we worked on that. If you look at this, how far the yellow line is from the blue line when we first started, and then if you look at it here, we are starting to improve the curve of the neck. Not perfect, still needs more work, but much different than here. His neck is literally going the opposite way. His head is literally on backwards. Okay? And what did we do to help with that? Well, we did a type of traction for that. So you can't really see here. There's a little block that goes underneath the small of his neck, and we have a block here. And that also worked on the alignment of his neck and his lower back from the side. So again, we work on the alignment from the front, alignment from the side, and movement. Now we talked about movement, okay? So let's talk about that. Every vertebrae should move a little bit. When we bend in the spine, and if we look at here, he's bending to the right. So if my back is towards you, we're bending this way in this picture. We're bending to the left in this picture, and this is bending to the right 3 months later. So what we want to see, what a normal spine, when you bend to the right, it should be wide. These yellow lines should form an angle, like a letter V. It should be wide here, pinching here. So this one moves, that's a good one. That moves, that one's stuck. Now when he goes left, remember, when you go to the left, it should be wide on the right side. It should be gapping and pinching. So it should tip. So right where I wrote good tipping, that's a good one. See how it's wide here. The yellow lines are wide and they're pinching on the left side. This is the right, this is the left. So these two vertebrae moved, but if you look at number 3, 4, and 5, they're moving opposite the way a normal human being spine should be. And that is very common in a disc herniation. And so one of the most important tests, if you have a disc herniation, particularly if you're failing traditional conservative care, you're failing physical therapy, you're failing chiropractic, you're failing exercise, you need to get a motion X-ray. The motion X-ray will help pinpoint the location and severity of any ligament damage. And remember, the disc is the ligament. So in addition to an MRI, you need to have an X-ray from the front and from the side, and you need to have a motion X-ray. Now, this is him bending right, this is him bending right at the end. Near perfect motion. Let me show you what it looks like him bending left at the end. So this is the end bending right, this is the end bending left. Now remember, we want to see gapping on the right side of the vertebrae when we bend to the left. We want to see the vertebrae do that. That's a good one, that's a good one, that's a good one, that's a good one. This one still needs work. It's better than what it was. Remember when he first came in, it was opposite normal movement. It was wide on the left, which is opposite. Now it is just not efficient. This one moves, this one moves, this one moves, this one moves. So out of 5 vertebrae, when he first came in, he had 3 that were what we call pathological. We actually can grade your motion. We can give you an engineering analysis, whether it's mild, moderate, or severe. So huge change in terms of alignment, huge change in terms of movement, good change on the curve in his neck and low back, huge change in pain relief, huge functional change, okay? So again, correcting a spine with a disc herniation, you have to measure first. There should be no guessing. You should have an MRI, you should have an X-ray from the front, you should have bending X-rays showing the location and severity of any disc or ligament problems, and you should have an X-ray from the side. These X-ray guide our specific treatment. It will guide the type of adjustments that are safe and effective. It'll guide the exercises that you should do to fix your spine, and it'll guide us on what exercises you should not do. It'll guide your ergonomics at home, how you should sleep, lift, bend. It will guide the traction we do to mold your spine. So again, it's very important that whenever you see a provider with a disc problem, that they take these motion X-rays so they can treat you as an individual. So, what do we learn from this? Number 1, if you have failed getting rid of your pain from a chronic L4-L5 disc problem, it's not your fault. And usually there's a structural imbalance. Either your spine is out of alignment from the front, it's out of alignment from the side, you have bad movement in the individual vertebrae. A motion X-ray will guide your treatment. And as a rule of thumb, a corrective care chiropractor will prescribe corrective mirror image adjustments, corrective mirror image rehabilitation exercise, and corrective spinal remodeling traction. So if you're failing what you've been doing and you want to find a corrective chiropractor, just ask me and I'll help you find one. I'll leave a note on what to look up for in idealspine.com, and that way we can help you get relief so that you can live stronger longer and live the life you want. So again, I'm Dr. Gregory Kramer, chiropractor, Livonia, Michigan. I look forward to seeing you on our next video.